So we talk about anomalies and structures of kidney, like we did the last time. So anomalies of structure and the function of kidney. We'll start with renal agenesis. Now, renal agenesis means a kidney that is not formed or not properly formed. If it is bilateral, it's automatic death. Usually it's unilateral and is actually very rare. Large compensatory or contralateral kidney will be seen in these cases of renal agenesis, where it is unilateral because the other one does the job of two, so it becomes larger. Often you'll see an elongated adrenal gland that is visualized. Remember, the adrenal gland is just on the kidney, so when the kidney is not formed, the adrenal gland becomes larger and elongated, and it may be associated with cystic seminal vesicle or unilateral seminal vesicle agenesis in male, or uterine anomaly in female, like you have in the uterine didelphys or bicornate uterus. There is the Porter's syndrome. This is the bilateral agenesis of the kidney, non-visualization of the urinary bladder, oligohydramnios, and pulmonary hypoplasia. So, looking forward, we'll look at hypoplastic kidney. So, hypoplastic kidneys in ultrasound, basically these are small, underdeveloped kidneys. Unilateral with a compensatory hypertrophy of the opposite kidney. And normally that's what will happen when one is hypoplastic, underdeveloped, the other one takes control of double function to compensate its functionability. In ultrasound, the hypoplastic kidney appears small but otherwise normal. Now, differential diagnosis will be atrophy from infarction or infection, small contracted chronic renal function of the kidney, duplicated collecting system, and duplex kidney or bifid kidney. Duplicated collecting system, duplex kidney, or bifid kidney, these are one and the same thing. So let's take a look at it. This is a very common renal anomaly with unilaterally enlarged kidney, seen in like 1% of the population. In ultrasound, you will see an enlarged kidney with a large cortical area between the separate renal sinus and the pelvises. Now, two common types are seen. There is the incomplete duplication, mostly common and involves two complete separate renal pelvises with fusion of their ureters. So only one ureter inserts into the bladder. The insertion site into the bladder usually is normal. Then the complete duplication consists of two renal pelvises and two ureters. The upper moiety, that is the upper portion of the ureter, will have an ectopic insertion into the bladder. 50% of this abnormal insertion is associated with an ectopic ureterocele with partial or total obstruction of the upper portion or moiety and obstructive hydronephrosis. The lower moiety is associated with vesico-ureteric reflux in majority of the cases. Duplex kidney may be associated with other anomalies. In male, agenesis or dysplastic kidney, agenesis of seminal vesicle or cysts in the seminal vesicle. In female, there is uterine anomalies like bicornate uterus, uterine didelphys, or duplication or atresia of the vagina. And now a quick one, let's look at extrarenal pelvis. The renal pelvis is not within, in this case, the renal pelvis is not within the renal sinus. Instead, it is located medially in the perinephric fat. Frequently may be seen associated with rotation of the kidney. External pressure by lower surrounding tissue will cause chronic dilatation of the pelvis. This should not be mistaken for hydronephrosis. So you just understand the anatomy of the normal and the abnormal. Malrotation of the kidney, usually there is an unusual axis of the kidney. It can appear abnormal on a normal IVP, frequently associated with extrarenal pelvis. So have you heard about renal sinus lipomatosis? This is a heavy deposition of fat in the renal sinus. Now, with advancing age, the renal parenchyma thickness decreases, whereas the amount of renal fat increases. Thus, you have the larger, highly echogenic renal sinus that can be seen, and also can be mistaken as sinus neoplasm. Little is known about medullary sponge kidney. This is also called renal collecting tubular ectasia. MSK in short is a congenital defect with the formation of microscopic cysts in the collecting tubules. Thus, you have that spongy appearance. Now, this disease is present at birth, but is not apparent until adulthood. So it may be there from birth, but usually it manifests in adulthood. Generally is asymptomatic, other than the high risk of nephrolithiasis, kidney stone, and hematuria. May be normal on other imaging. You may do several scans, you may just come back normal. But on ultrasound, there is increased intermedullary echogenicity, which may surround the pyramids. This is suggestive of, but not specific for MSK, medullary sponge kidney. In children, the sonogram is usually normal. But remember, we say it can manifest in adulthood. Quickly, let's talk about calyceal diverticulum, or what you would call congenital megacalces. Now, these are typically unilateral. They are non-obstructive cystic enlargement of the calyces. It is usually non-progressive. The renal parenchyma or cortical thickness and renal functions are normal. They remain normal. Infection and stone formation increase because of this. Commonly is associated with primary megaureter. On ultrasound, you'll be seeing a large clubbed callus or calyceal cysts with normal cortical thickness. Megaureter is an anomaly where the distal ureter is abnormally dilated. It is an uncommon condition which is more common in males. It may be bilateral or often, and can even be often associated with other congenital anomaly. The cause is thought to be due to a peristalsis of the distal ureter, leading to dilatation and functional ureteric obstruction and a tendency to infection. The ureteric orifice appears normal and ureteric catheter will pass through easily. On ultrasound, you see a fusiform dilatation of the distal third of the ureter. Depending on the severity, hydronephrosis may or may not be present. calculi may form just proximal to the non-dynamic segment. Let's do a quick one on ureterocele. This is a cystic outpouching of distal ureter into the urinary bladder. It is resulting from a spectrum of abnormal embryogenesis, which is associated with anomaly or anomalous development from intravesical ureter, the kidney and the collecting system. Uteroceles may be unilateral or bilateral, may be symptomatic and present with wide range of clinical signs and symptoms, from recurrent cystitis, bladder outlet obstruction, hydronephrosis, or renal failure. May be associated with a normal, well-functional kidney to a non-functional dysplastic renal kidney.